Chapter 3. What's so great about you? Understanding the marketability of your practice. As we saw in the previous chapter, effective marketing starts with a better understanding of the dental consumer's mindset. If you can relate to the needs of ordinary people and communicate with them at their level of understanding, your marketing efforts will have more impact and produce better results than those of your competitors. The next critical step in developing a good marketing strategy is to develop a better understanding of your own practice. Now, this statement may ruffle a few feathers. If you're like most of the dentists we consult with, you believe that if there's one thing you know inside and out and upside down, it's your dental practice. You built it from the ground up. You carefully selected every piece of equipment, stick of furniture, and retractable pen within those four walls. You spend most of your waking hours in it. What could you possibly not know? It's a very reasonable question, and one that we'll answer in a moment. And the answer will help you see your practice in a totally different light. Throughout this chapter, you'll learn how to identify elements of your practice that are truly marketable, and that the general public will find desirable, impressive, and compelling enough to make them pick up the phone and make an appointment. These elements are not going to be any of the things that might come to your mind right now. Let's start by examining the difference between reality and perception, and the ways in which they can play havoc with the way you market your practice. Reality and perception, why you and your patients live on different planets. Dental consumers, the people you're trying to reach with your marketing efforts, have an existing known reality related to dentistry. Their reality is based solely on the sum total of their prior experiences at the dentist's office, if they have ever had any. That's it. Perception is a whole other ballgame. Perception has nothing to do with reality. Humans create perceptions about something from indirect influences, such as information they receive from friends and family, items they see in the newspaper, or on the web, or on TV, and the pervasive effect of advertising. For instance, have you ever owned a pair of Nike sneakers? If you have, your experience of Nike sneakers is based on reality. If you haven't, you have no real experience and have to fall back on perception to make your evaluations. Whether that perception is positive or negative, it has no relation to reality. Of course, that perception can be just as powerful as the reality, which is why marketing powerhouses like Nike spend more than $1 billion each year to alter people's perceptions. How about Geico Insurance? If you don't have a Geico policy, you probably still have perceptions about the company and the brand. If I ask you what you think about Geico Insurance as a product, you'd have an opinion. If I asked you what you thought about the caveman or the talking gecko, you'd have an answer. If I asked you whether you liked or disliked Geico, you would have something to say. Yet everything you think and feel about Geico, however strong those assumptions and opinions might be, are perceptions without any basis in reality. If I shared your perceptions about Nike with a footwear designer, or your opinions about Geico with an insurance professional, they would probably feel as though we were speaking different languages. Their insider knowledge of the reality of these subjects means that they see them in a totally different way. That's exactly the phenomenon you face when marketing your dental practice to the ordinary consumer. Your reality as a dentist is not the perception of the dental consumer. The dental consumer's perceptions are so far removed from your reality that you really are almost living on different planets. So how do we get everyone back on the same page? Recognizing existing perceptions and use them to your advantage. By recognizing the ways in which ordinary people perceive the field of dentistry, you can figure out what really impresses and appeals to them, and then market the heck out of it. Fortunately, the average dental consumer is easily impressed. The previous chapter revealed how little most people know about dentistry. Most have never even heard of things like periodontal laser treatments, one-visit crowns, one-visit whitening, or dentist-administered migraine treatments. The dental consumer knows hardly anything about today's dentistry. Their perceptions of your practice are so limited, it's easy to wow them. Things that are a routine part of your business are revolutionary to your potential customers. You live with dentistry every day, and the excitement wears off. For consumers, it's all new. Almost everything about today's dentistry can be made to be, at best, exciting, and at the least, informative and useful information. The key is to go down to the consumer's perceptual level when you start to build your list of marketable attributes. Why digital X-rays are a major newsflash. Let's take a look at a specific example of ways to exploit the difference between consumer perception and reality. Let's say there are 25 dentists in and around your general market area. You know that all of the dentists in the area employ digital X-rays in their practices. To you, the consumer benefit of digital X-rays is hardly even worth mentioning to the general public. Everybody offers them, so they don't offer a compelling reason for anyone to choose your office for their dental needs. Wrong. If none of the other 25 dentists in the area promote their use of digital X-rays, the perception of the dental consumer will be that your offering is unique. As far as they know, yours is the only office in the area offering this remarkable technology. And if your marketing materials sell the benefits of digital X-rays in language the consumer understands, they will pass over your 25 competitors, all of whom offer the exact same service, and book an appointment with you. Let's look at another example. Let's say you started using CAD/CAM technology in your practice a few years ago. To you, it's old news. Sure, it's a useful part of your practice. Sure, it's pretty fun to play around with. But none of your patients is going to care about how fun it is for you to tinker with your CAD/CAM machine. Wrong again. How do you think the general public would respond to some of these benefits? Same-day restorations, no temporary teeth. No need to bite down on a tray of nasty blue gunk. Instant adjustments for the perfect fit. Years' worth of dental work done in just one visit. Maybe you recognize some of these consumer benefits, maybe you didn't. Almost every business owner is too close to their own area of expertise to effectively promote their own business. That's why advertising and marketing firms exist. But by understanding the gulf that exists between public perception and the reality of your dental practice, you are more than halfway towards being able to beat some of those professional marketers at their own game. Step outside of your own knowledge base. Take a fresh look at the many services you offer and the advantages to the consumer that those services provide. The dental consumer's limited perception is a pretty powerful marketing agent if you know how to make it work for you. Once you understand the public's perception of dentistry, you can use it as the baseline for your list of marketable attributes that you'll showcase in all of your marketing materials. The value gap. Why leading with low prices is a big mistake. As you have seen, the difference between perception and reality can be used to your advantage. But there is one area where the difference is not in your favor. This is the value gap, a term that doesn't mean a whole lot to people who don't have a business degree, but it's an important concept to understand when it's your business to promote the value of your product or service to the public. So what is the value gap? The official definition is the positive or negative difference between the perceived value of something and the true value of something. In dentistry, the value gap means the public still believes dentistry is the same as it was 50 years ago. This is great news when it comes to dazzling them with new technology that you've been using for 15 years. But it's bad news when it comes to convincing them that your services don't cost the same as they did 50 years ago. The dental consumer believes your fees are too high because they do not understand the value of what you provide. And presto, you've got a value gap. Now, the value gap is not real after treatment. Patients do pay you the fees you charge after you treat them, and they see the value of the service you provide. The value gap only exists before they become your patients. This is an important distinction. The most important thing to understand is that lowering your prices will never close the value gap. In fact, taking this approach will only widen the gap further and have you chasing after scarcer and scarcer dollars. Please memorize the following two statements. Promoting your practice primarily through financial incentives makes the existing value gap larger. If you make the value gap larger, there is downward pressure on pricing, your fees, and your fees will be harder to collect. In other words, low prices deflate the value of the service you provide. Promoting your practice primarily through the benefits of today's dentistry makes the existing value gap smaller. If you make the value gap smaller, there is an upward pressure on pricing, your fees, and your fees will be easier to collect. In other words, charging full price for your services reinforces the perception of their value. Make these two principles your new marketing mantra. Repeat them every time you're tempted to distribute a tacky postcard offering a $59 exam and x-ray special, or participate in one of those discount coupon books that usually end up in the recycling bin anyway. Attempting to attract people to your practice that are interested in great health care rather than a deal will ultimately provide you with a practice you desire. Yes, we understand that good prices and good service are not mutually exclusive, but dentistry as a whole relies way too much on attracting new patients primarily through financial incentives. When you do a good job of promoting the value of your services, you won't need to compete on price, ever. Conveniences, technologies, and 10 other reasons for patients to pick you. Now that you've discarded rock-bottom prices as your key differentiator, let's replace price with a list of other competitive advantages that will actually draw business to your practice. In our experience, developing this all-important list of marketable attributes is probably the most difficult thing for a dentist to do. We're going to spend a lot of time here, most likely attempting to convince you that your dental practice is definitely marketable beyond just offering a deal. At least 5 marketable attributes are staring you in the face. Conveniences. As we learned from the survey covered in the previous chapter, conveniences really resonate with the dental consumer. So let's think about the conveniences your dental practice offers. If you can think of one or two, you're thinking like a dentist. Take a look at the list below and check off every convenience your practice currently offers. You are likely to possess at least 5 of them. Do you offer patient financing? Do you offer evening or early morning hours outside of 9 a.m. to 5 p.m.? Are you willing to work on the whole family, not just the adults? That's real convenient. Is your office in a convenient location? Is the street or lot packed, or do you have lots of parking available? Do you offer a broad range of services so you don't need to refer anything out of your practice? That is incredibly convenient and marketable to the dental consumer. Do you have Wi-Fi in your reception area? Do you handle emergencies? Do you have a children's play area in your reception room? Moms and dads love that. Are you open on Saturdays? Can you place a restoration in just one visit? Do you offer sedation so that the patient can get years' worth of dental work completed in one visit? This is a huge convenience. Do you offer 6-month ortho? What a time-saving convenience that is. Can you appoint patients according to their availability? By now you get the idea, and once you get the hang of it, you'll probably think of even more convenient services and amenities your practice offers. Now, we're not suggesting that you fill your ads with long, bulleted lists of conveniences. Boring. but you should definitely highlight those that you think will resonate with your audience. Pretend your customers are stuck in the 1950s. Technologies. In the previous chapter, you learned how incredibly important technology is when the consumer chooses a dentist. We bet that it was a bit of a surprise to some of you. But what exactly can you say about technology to elicit a positive response? Do you just list all the technology you have in an advertisement? Do you just put a name to all the gizmos and lasers and radiography? Of course not. Dental technology is another area where the dentist's reality and the consumer's perception are greatly confused. The consumer perception of technology is that a good dentist knows all about the latest technological advancements, but their understanding of what those latest technological advances actually are is many years behind the times. The consumer reality is largely non-existent unless that consumer is a patient at a dental practice that actually explains the benefits of their technology. And that's a rare instance. The dental consumer still thinks you practice 1950s dentistry simply because nobody is telling them any different. There's that value gap again. You're certainly not telling them any different because you take the technology you use in your profession for granted. It's old hat. It's yesterday's news. Boring. Remember, what's boring to you is brand new information to 90% of the dental consumers out there. They don't know anything about the benefits of your technology. It's time to educate them about what's possible in dental care today. Let's dive into a couple of common technologies that are very marketable. We already looked at CAD/CAM technology. Let's take a look at a couple of other common technologies that most dentists use, but would never think of marketing. Consider the Diagnodent. Thousands of dentists use one on a daily basis. Few dental consumers have a clue what the heck a Diagnodent is, what it does, or how it benefits them. Remember, we are bridging a value gap. So how do we close that value gap? How do we describe the benefits of a Diagnodent to the dental consumer so they understand and see the benefits? It's not easy. It took us several tests to finally get it right. Here's what resonates with the dental consumer regarding the Diagnodent. Laser scanner finds cavities years earlier than before. No painful poking, scraping, and prodding involved. Dr. Smith has invested in this amazing tool in support of his commitment to keeping his patients healthy and keeping their dental costs down. We can detect decay that is often the source of tooth sensitivity before it spreads from within the tooth, allowing us to alleviate your discomfort. Didn't know a Diagnodent did all that, did you? That's okay. That's the difference between living with and using a Diagnodent all day and being bored with it, and promoting its use effectively to the dental consumer. Almost all of your marketable attributes can be made to sound exciting, new, and unique. Remember, it's the perception of you and your dental practice that we are trying to build or improve. Now, how about the intraoral camera? Yes, the same intraoral cameras that are about, 25 years old in dentistry? Remember when they first came out? Even dentists were excited about them. So many dentists have them that it makes sense that a dentist wouldn't think of actually marketing the fact that they use one. Why would they? It's old, right? Well, not to the dental consumer. Check it out. See exactly what Dr. Smith sees. Dr. Smith has invested in an amazing new technology, the mini intraoral camera, that actually allows his patients to see what he sees inside their mouths during examination. Dr. Smith says, it is sometimes difficult for patients to understand the need for care or home maintenance when they can't see it for themselves. Our patients can see everything we see, so they completely understand our treatment recommendations. Instead of a dull, decades-old dental practice mainstay, the intraoral camera has become something new and interesting. Even more, it addresses one of the biggest barriers to forming good dentist-patient relationships, and that would be lack of trust. By describing the way the camera helps patients look over the dentist's shoulder, so to speak, This old technology becomes a powerful way to establish trust and confidence. One of dental consumers' biggest fears is that dentists overdiagnose and overtreat their patients. As a consumer, isn't it reassuring that Dr. Smith invested in technology that allows them to see what's going on in their mouth before he recommends treatment? Consumers think so, even if the technology is over 25 years old. Growing your marketability for a successful future. Conveniences and technologies are two areas that are like found money when it comes to marketing your practice. You don't have to do or invest in anything new. It's all right there waiting for you to use in your marketing strategy. You're just looking at what you already do with new eyes and identifying the benefits to your target market. But there are also things you can do to take your marketability to the next level. New technologies. That's really new, not new to the average consumer. New services, new conveniences, new payment plans, new amenities, and even new little luxuries can make your dental practice more marketable now and ensure that you stay competitive in the future. To make it easier for you, we prepared a master list of marketable attributes that a dental office can possess. Go ahead and put a check mark next to the boxes that already apply to you. Anything that's left blank at the end of this exercise is a viable way to improve your marketability. Once you've finished filling in the boxes, we'll explore some of the options in greater depth. Sedation dentistry, video games, dentures, headphones, aquarium, tray bleaching, educational videos, oxyfresh or similar, blankets, ortho, children's play area, nitrous, parking vouchers, implants, hot scented towels, mouth guards, internet room, laser bleaching, free parking, endo, massage, halitosis treatment, Botox, Invisalign, cosmetic specialist, IV sedation, high-tech practice, bright smile, health-oriented, snore guards, Rotodent, kids specialist, TMJ, ultra sterilization, accelerated ortho, red carpet service, intraoral camera, virtually painless, digital x-ray, no needles or drills, air abrasion, family-oriented, hard tissue laser, artistic, diagnodent, female dentist, the wand, ethnic, soft tissue laser, high credentials, CAD/CAM or equivalent, convenient hours, convenient location, imaging, oral surgery, movie glasses, more experience, emergencies. We do it all. All right, now take a look at the boxes that do not have a check mark next to them. Which of these blanks will resonate best with the dental consumer? Take a look at the survey results presented in the previous chapter and think about which services would be a strategic addition to your current offerings. Which ones do you think would have the greatest impact? And which of these would be implemented for a relatively modest expense? You'll have a sense of which offerings will work best for your market, but we'd like to share some of our wisdom collected throughout many years of helping dentists improve their businesses. Try adding surefire business-boosting services. Rounding out your service offerings is a fantastic way to increase production in your practice and make your practice more marketable. If you are a general dentist who does not do pedo, endo, extractions, implants, or basic ortho, you might consider starting there first. With years of experience helping dentists improve their business, we can affirm that a broader service mix results in better productivity as well as better marketability. There are no magic formulas for the perfect service mix, but we can recommend these service areas that resonate particularly well with dental consumers. If you're interested in expanding your service area, take the following offers into consideration. Sedation. Sedation dentistry isn't new to you. To the general public, however, it's still pretty advanced stuff. If promoted properly in the right market, sedation dentistry adds a very valuable and very promotable tool to your list of marketable attributes. There is a segment of the consumer demographic that is still very concerned about the pain involved in dental procedures, and they will respond very favorably to this new service offering. This demographic segment includes people aged 55 plus who may have painful memories of going to the dentist 20 or more years ago, when painful treatments were much more common. Sedation may also appeal to the children of the 55 plus set who have probably inherited their parents' anxieties. The remaining slice of the sedation market includes people who have neglected their dental health in the past and are now confronted with the need for extensive dental work. Sedation is a very attractive option and usually a deciding factor for consumers in need of major dental repair. Core deep bleaching. The market for incredible whitening results is vast and shows no signs of diminishing. In fact, a recent study by the American Academy of Cosmetic Dentistry revealed that the majority of respondents would choose teeth whitening as the first thing they would do to improve their smile. If you're anything like the dentist we consult for, you may be worried that the market has shrunk because of all of the over-the-counter whitening products available at any drugstore or supermarket. We'll tell you the same thing we told them when they came to us in a panic. Cheap take-home teeth whiteners are the best things ever to happen to your business. Sure, anyone can try to whiten their teeth with a $20 kit, and millions do, but these products do not result in the dramatic differences that the consumer is expecting. So now there are millions of people who know they want whiter teeth and realize they need to see a professional to get the results they desire. It's a major opportunity to acquire long-term patients. If you offer core deep bleaching, there are two attributes that are clearly unexpected to consumers and which you should discuss. The first is that it has been successful in whitening tetracycline-stained teeth, a problem that even previously tried professional systems have not been able to fix. Furthermore, it has eliminated some of the other shortcomings of early whitening systems, such as tooth sensitivity, uneven results, or results that fade. As with over-the-counter whitening, the fact that a patient may have tried something before and you can now overcome their prior failure is something that positions you further in their mind as a leading professional. Footnote: Rod Kurthy, owner of Core Deep Bleaching and Evolve Technologies, is a dear friend of Howie Horrocks, one of the authors of this book. However, neither New Patients Incorporated nor the officers of NPI receive any financial benefit from recommending this service. Short-term orthodontics. Short-term ortho is a rapidly growing service area that's popular with dentists and patients alike. It is starting to replace the aligner market as a lower-cost alternative that gets better results. And patients who resist using aligners are more likely to accept short-term orthodontics. Adding this service to your practice and promoting it properly in your marketing materials can be a very profitable move. Sleep apnea. Sleep apnea is an emerging treatment trend in dentistry, and it has the potential to increase your business. Sleep apnea can be a devastating condition that affects people's psychological and physical well-being. Positioning yourself as a sleep apnea treatment provider allows you to connect with new patients who are not currently looking for a dentist. It allows you to attract new patients for something perceived to be outside the scope of dentistry. And once you treat them, you have every opportunity to keep them as your dental patient. Consider a moderate investment in technology. Is technology the best investment you can make in your practice? Not always. As you learned in the previous chapter, consumers do value the benefits of technology, but as you also learned, their idea of what constitutes the cutting edge is often pretty backward. However, it is important to present yourself as a dentist who is aware of and uses the latest equipment and techniques in your practice. New equipment is by no means the best way to improve your business in every case, or even in most cases. However, if you are in the market for some additional technological solutions to add to your practice, we recommend CAD/CAM and laser dentistry as the most marketable technological innovations. In our experience, these are dental technologies that impress consumers and offer benefits to which they can relate. Improve the level of convenience you offer. If you're looking for new benefits to market to potential clients, there's no more cost-effective way to create them than to add some conveniences to your practice. No expensive new equipment needed, no costly training required. Just spend some time thinking about what will make it easier for your current and potential patients to use your services. Conveniences are particularly popular with busy mothers juggling work and family priorities. And as you discovered in the previous chapter, women are the primary decision makers when it comes to the family's health care. Never underestimate the power of convenience on today's busy mom. If you are a dentist mom yourself, you know how crazy your days can be. If you are male and married with children, you know how crazy your wife's life is these days. Today's mom really appreciates almost anything that will make her life easier. Here are two conveniences that are very popular and very easy to add to your marketing materials. Convenient hours of operation. We can't tell you how many times a dentist will tell us that they have very convenient hours of operation. Then they tell us they work Monday through Thursday from 8 a.m. to 4 p.m. Those office hours are only convenient to you. As a rule of thumb, we recommend offering 4 hours per week outside the 8 a.m. to 5 p.m. Monday through Friday time slot. You don't have to add extra hours to your schedule. Just rearrange those hours to accommodate people who can't get away during normal working hours. Then promote your convenient morning and evening appointment hours in your marketing. And keep those special hours for appointments with new patients only. If you want to determine just how important this marketable attribute is, you need not go very far. Just go and look at your current schedule. If you are like most dental offices, the appointment times that are filled first are early in the morning, in and around lunchtime, and late afternoon. That is the dental market sending you a clear message. They really prefer convenient appointment hours that better fit their lifestyle. That single marketable attribute alone can increase the response or inquiries from your promotion by 10%. Convenient location. If your dental office is located close to a landmark that will be familiar with the women in your community, we want you to say so in your marketing. For example, we are 3 doors down from Prescott High School. We are right next to Curves, across from Richland National Bank. We are across the street from Wildwood Day Spa. Why do this? It's called familiarity. Familiarity breeds comfort. The human brain does not like uncertainty. It's attracted to the familiar and the predictable. Marketing research shows that people will often drive a little further to buy something in a familiar area, even if there is a comparable option nearer to home. Because they are extremely familiar with the area, they prefer to make their purchase there. You probably do something like this 2 or 3 times a week and aren't even aware of it. Before we leave this chapter, here are 10 more quick reasons that patients might choose you. You might have an awesome employee your patients rave about. You could have celebrity clients, the police chief, the mayor, the morning news anchor. You have been interviewed or quoted by the local media. You have published articles or studies in the dental or mainstream media. You have presented a seminar to or taught other dentists. You have lectured to dental groups or community groups such as schools, seniors, associations. You have participated in clinical trials for new consumer dental products or equipment. You have postgraduate education in your field. You have received special awards or commendations. You give back to the community through volunteer service or donations. Recap what we've learned in this chapter. In this chapter, you have seen how important it is to recognize the difference between perception and reality. You have learned how to use dental consumers' perception to your advantage in your marketing materials. And you've seen how the lag between the perception and reality of dental technology offers an opportunity to promote old technology as an exciting and unique consumer benefit. We hope that we have also shown you the damaging effect a different kind of consumer perception, the value gap, can have on your business. If you retain only one marketing concept from this entire book, we sincerely hope it's the idea that marketing yourself on price alone only devalues the service you offer. We introduced you to a list of marketable attributes that you can use to promote your services to dental consumers in your area. And we provided insights and recommendations on how to improve your marketability in the future to stay competitive. Hopefully, the checklists we provided have opened your eyes to the marketability of some of the ordinary day-to-day services and amenities you already provide, and given you ideas for new conveniences and technologies that will open up new and profitable possibilities in the future. The next step is to start with the easy ways to improve your marketability first. Try getting through the list at a pace of 1 per month. Some of them require time, money, or continuing education, so take your time, but stay with it. At a rate of 1 item per month, you'll have a dozen more reasons for consumers to choose your practice next year. So what's next? First impressions count for a lot in every business, and the business of dentistry is no different. That's why choosing a name for your practice is such an important part of your overall brand. In the next chapter, we'll share tips on finding a practice name that's memorable, descriptive, and that sets up positive associations in the public's mind.